After 50, you may notice something strange happening to your stomach. Maybe your belly suddenly looks different, even though your weight hasn't changed much. Maybe when you sit up from bed, stand after lying down, or tighten your stomach, you notice a ridge or bulge running straight down the middle of your abdomen. Or perhaps your stomach feels unusually weak. You may have started avoiding certain clothes because your abdomen seems to push forward no matter how carefully you eat. And maybe you've been telling yourself the same thing millions of people tell themselves, I'm just getting older. But what if aging isn't the whole explanation? What if that persistent bulge, that feeling of abdominal weakness, or that strange ridge down the center of your stomach is actually of something called diastasis recti? And here's the part I really want you to understand. Diastasis recti isn't simply a cosmetic problem. It involves the connective tissue between the two sides of your abdominal muscles. And in some people, it can be associated with reduced core stability, difficulty generating abdominal pressure normally, and other symptoms that can affect everyday movement. The good news is that discovering it does not automatically mean you need surgery, but there is also something you should never do. Don't assume that every abdominal exercise is automatically safe just because it strengthens your stomach. Some exercises can increase pressure inside the abdomen and may make your symptoms or bulging more noticeable. So if you're over 50 and you've noticed a new or persistent change in the shape, strength, or function of your abdomen, stay with me. Because before this video ends, I'm going to show you how to recognize the warning signs, what commonly makes the problem worse, why age can change the way your abdominal wall responds, and the first practical step you can take instead of simply ignoring it. Let's start with what is actually happening underneath your skin. Imagine looking at your abdominal wall from the front. You have two large muscles running vertically down the front of your abdomen. These are the rectus abdominis muscles. One sits on the right, the other sits on the left. Normally, they are connected near the center by a strong band of connective tissue called the linea alba. Think of that tissue like a central seam holding the two sides of a jacket together. When the abdominal wall is functioning normally, that seam helps transfer force between the muscles and contributes to the stability of your trunk. But when the linea alba becomes stretched and the two sides of the abdominal wall move farther apart, a separation can develop. That's diastasis recti. And this is where many people make their first mistake. They look at their stomach and think, I have too much fat. So they start doing more crunches, more sit-ups, more leg raises, more aggressive abdominal workouts. They assume that if the belly is protruding, they simply need to work the abdominal muscles harder. But that's not necessarily the answer, because if certain movements cause your abdomen to bulge outward or create a visible ridge along the midline, repeatedly forcing through those movements without understanding what's happening can be counterproductive. This is why the first question shouldn't be, how many crunches should I do? The better question is, why is my abdominal wall behaving this way? And after 50, that question becomes even more important. Your body doesn't suddenly stop working when you reach 50, but tissues change. Muscle mass tends to decline with age if it isn't actively maintained. Connective tissues change. Recovery can become slower. And years of previous pregnancies, major weight changes, abdominal surgery, prolonged inactivity, or repeated increases in abdominal pressure may all contribute to problems with abdominal wall function. That's why diastasis recti isn't something that should be thought of as a condition belonging exclusively to younger women after pregnancy. Pregnancy is a major risk factor, absolutely. But it isn't the only situation in which abdominal separation can occur. Men can develop it, older adults can develop it, and women who have never been pregnant can also experience abdominal wall separation. So if you're sitting there thinking, that can't possibly be me, don't dismiss it simply because you don't fit the stereotype. Now let me give you one of the simplest clues to watch for. Stand in front of a mirror. Don't suck your stomach in. Don't pose, just relax. Then gently tighten your abdominal muscles or slowly move from lying down towards sitting. Watch the center of your abdomen. Do you see a ridge, doming, or unusual bulging along the middle? Does the shape of your abdomen change dramatically when you engage your core? Does your stomach feel unusually weak or unsupported? Those signs don't prove that you have diastasis recti, and that's important. A visible bulge can have several causes, including a hernia, and those conditions are not interchangeable. That's why self-diagnosis has limits. If the change is new, painful, significant, or persistent, getting assessed by a qualified healthcare professional or physical therapist who understands abdominal wall problems is much safer than trying to diagnose yourself from a YouTube video. Now here's where the story gets interesting, because many people don't notice diastasis recti because of the gap itself. They notice what happens around it. They may feel that their core isn't as strong as it used to be. They may have difficulty getting up from the floor. They may feel less stable during certain movements. They may notice abdominal discomfort, or they may simply feel that their stomach doesn't respond the way it once did. And sometimes the biggest clue isn't pain at all, it's pressure. Think about what happens when you cough, when you sneeze, when you lift something heavy, when you strain, when you hold your breath during an exercise. All of these situations can dramatically change pressure inside your abdomen. Your abdominal wall has to respond to those pressure changes. And if the system isn't coordinating properly, you may notice bulging or doming through the midline. This brings us to one of the biggest mistakes I want you to avoid. Stop assuming that more core work automatically means better core. It doesn't. Your abdominal muscles are part of a much larger pressure management system, involving your diaphragm, pelvic floor, back muscles, and deep abdominal muscles. Good core function isn't simply about having hard six-pack muscles. It's about coordination. It's about controlling pressure. It's about being able to breathe while your trunk remains stable. And after 50, that distinction matters enormously. Because your goal isn't to win an abdominal exercise competition. Your goal is to build a body that remains stable when you walk, bend, lift, reach, climb stairs, get out of a chair, and carry groceries. That's functional strength. And that's where a safer approach begins. Instead of immediately attacking your stomach with hundreds of repetitions, start by learning how your abdominal wall responds to breathing in gentle tension. Lie comfortably on your back with your knees bent. Place one hand on your lower abdomen. Take a slow breath in through your nose. Let your ribs and abdomen expand naturally, then breathe out slowly. As you exhale, gently engage your abdominal muscles without aggressively sucking your stomach inward and without holding your breath. You should still be able to breathe. That detail matters. You're teaching your trunk to create controlled tension rather than simply forcing pressure outward. Repeat this gently and pay attention. Does your abdomen move smoothly? Or do you notice pronounced doming or bulging? Does the movement feel controlled? Or does your abdomen seem to push outward under very little effort? These observations can tell you something useful about how your abdominal wall is functioning, although they cannot replace an examination. And there's another reason I want you to start gently, because the biggest mistake people make after discovering a problem is panic. They see the bulge, they search online, they hear the word separation, and suddenly they're convinced their body is falling apart. It isn't. A diagnosis of diastasis recti does not automatically mean that your body is permanently damaged, and it certainly doesn't mean that everyone needs an operation. Management depends on the severity of the separation, symptoms, underlying causes, overall health, and whether another condition such as a hernia is present. For many people, appropriately selected physical therapy and progressive exercise can improve abdominal wall function and symptoms. That's why I don't want you thinking about this as a battle against your stomach. Think of it as retraining a system, and that system can adapt. But there is one factor people over 50 need to take particularly seriously: muscle loss. As we age, maintaining muscle becomes increasingly important. If your abdominal muscles, hips, back, and legs become weaker because you're sitting more and moving less, your entire trunk can become less capable of handling everyday demands. That doesn't mean muscle loss caused your diastasis. It means that rebuilding overall strength can be an important part of restoring function. So don't focus exclusively on the visible gap. Look at the whole body. Can you comfortably stand from a chair? Can you climb stairs? Can you walk for 30 minutes? Can you carry a grocery bag without holding your breath? Can you bend down and return to standing with control? These are the real measurements of functional health. And here's something else I want you to remember. If you've been told that you need surgery simply because you have a gap, don't make the decision based on fear alone. Get a proper assessment. Ask what symptoms the surgery is intended to treat. Ask whether physical therapy is appropriate. Ask whether a hernia is present. Ask what the expected benefits and risks are. And if you're uncertain, getting another qualified medical opinion can be reasonable. Surgery has an important role in selected cases, but it should be a treatment decision based on your individual situation, not a reaction to seeing a number or a bulge in the mirror. Now, there's one more warning I don't want you to miss. If you have a new abdominal bulge that is painful, becomes hard or tender, cannot be pushed back when it previously could, or is accompanied by severe abdominal pain, vomiting, fever, or other concerning symptoms, don't assume it's diastasis recti. Those symptoms can occur with other abdominal conditions, including hernias, that may require prompt medical attention. And this is why getting the diagnosis right matters. Because two people can look at their stomach and see what appears to be the same bulge while having completely different underlying problems. Now let's bring this back to you. If you're over 50 and you've noticed your abdomen becoming more prominent, don't automatically blame age. Don't automatically blame fat. And don't automatically start doing hundreds of crunches. First, understand what's happening. Look for midline bulging. Pay attention to how your abdomen responds when you move. Notice whether you have weakness, discomfort, or difficulty with everyday tasks. And if you're concerned, have the abdominal wall properly assessed. Then build from there. Because the goal isn't simply to make your stomach look flatter. The goal is to restore strength, coordination, confidence, and function. And that is a much more powerful goal. Your body at 55 isn't supposed to behave exactly like your body at 25. But that doesn't mean you have to accept weakness as inevitable. You can still build muscle. You can improve balance. You can improve mobility. You can strengthen your core. And you can learn to move in a way that works with your body instead of constantly fighting against it. So tonight, don't lie in bed worrying about the gap. Tomorrow, don't punish yourself with 100 sit-ups. Start with awareness. Start with controlled breathing. Start with gentle abdominal activation. And most importantly, if you think you may have diastasis recti, get an accurate assessment before choosing an aggressive treatment. Because the biggest danger isn't necessarily the gap itself. The bigger danger is spending years treating the wrong problem. If this video made you look at your stomach differently, tell me in the comments. Have you noticed a ridge, bulge, or unusual weakness in the middle of your abdomen? And tell me your age. Because the more we understand what adults over 50 are actually experiencing, the better we can create practical, evidence-informed health education for this stage of life. If you found this helpful, share it with someone who keeps saying, "My stomach is just getting bigger because I'm getting older." Sometimes the body isn't simply getting older. Sometimes it's asking you to pay attention. And the sooner you listen, the sooner you can find out what's really going on.